everyone. Thank you for joining us today in our first ever Ask the Expert interview series. We are so happy to have Dr. Ashima Gupta with us today. We have been blessed to be able to work with her many times over the years in our Vision Van program as well as our KidSite program, and she has been a great partner of the foundation. We are excited to have her here today talking about some issues with children's eye health and safety, because August is Children's Eye Health and Safety Month, and we are wanting to kind of pick Dr. Gupta's brain about some common questions that parents have about their children. Before we get into that, I'm just going to give you a little bit of background information on Dr. Gupta. So she has worked here in Louisville at the Kumar Eye Institute since 2013. She works there with her brother and her father. Before coming back to Louisville, she worked for many years at the State University of New York as the Director of Pediatric Ophthalmology and Strabismus Services. Dr. Gupta completed her fellowship in pediatric ophthalmology at Northwestern University, and she obtained her medical degree at George Washington University Medical School. Before that, she completed her undergraduate degree here in Louisville at the University of Louisville. So welcome, Dr. Gupta. Thank you for joining us today.
Thank you. Thank you for having me.
All right. Well, we are excited that you came on to do this, but we don't want to take up too much of your time, so we are going to just jump into our questions. So one of the first questions that comes along when parents start wondering about their young children is, when should children receive their first eye exam?
So actually, all children born in the hospital receive their first eye exam within the first 1 to 2 days after birth by their pediatrician in the hospital. But after that, the pediatrician does examine the health of the eyes at all well checks, starting at 1 month of age, at least until 4 and often beyond that. However, in the state of Kentucky, there is a requirement that all children receive a formal eye exam by an eye doctor before starting kindergarten.
Okay. So it sounds like the pediatrician does a lot of that. What are some signs of vision issues that parents should maybe look for to know that they should take their child back to a pediatrician or an ophthalmologist or optometrist?
So the most serious sign would be an abnormal red reflex. This is often noted in photographs that the parents take, and they often note it in many photos. So although this would be very rare, it would be the most serious reason to be seen, because that can be a sign of a tumor in the eye. Other things that would be more common would be drifting or crossing of the eyes that especially persist past 6 months of age, abnormal tearing of the eyes, droopy eyelid, shaking of the eyes, and an abnormal head turn. Those would be the more common.
Okay. And then if a parent does notice one of these signs, or they notice something that's just abnormal for the child to be doing, what action should they take?
First, they should always speak with their pediatrician because that pediatrician will be able to give them the proper referral to the eye care doctor. Jennifer, I'm so sorry. Someone is knocking on the door. They're trying to get into the office and no one else is here. I'm so sorry.
You're fine. All right. While Dr. Gupta is away for a moment, just again, okay.
Do we need to start again?
No, we're fine. We're fine. We're just going to keep rolling. This is live. There's nothing we can do about it. So.
Okay. Can you ask me that question again now?
Okay, yeah. So if a parent does notice, that a child is having some of those symptoms, that they do see the red light, or they do notice the eyes misaligning, after the age of 6 months, what should the parents do first? What's the first step?
Yeah, so the first step is to reach out to their pediatrician so they can have a proper referral to an eye care doctor having expertise in that issue.
Okay. And then once they've had their first exam that you talked about prior to school, how often should a child have an annual eye exam, or I guess it's not annual, just a routine eye exam, past that first kindergarten eye exam?
So first of all, if the ophthalmologist or optometrist feels that they need to be followed, then they should just follow per their recommendation. Otherwise, the American Academy of Ophthalmology actually does not recommend routine eye exams for children who have no symptoms, no family history of congenital eye disease, uh, has not failed a vision screening test, and has no systemic illness that could be associated with eye disease, for example, diabetes or sickle cell disease, then they really do not need to have like annual eye exams or routine eye exams.
Okay. Okay. Mainly for
However, if they have not been able to go through a successful vision screening by the age of 3, or they have a suspected or confirmed learning disability or any other kind of developmental delay, then they should be seen, because sometimes an underlying eye problem can contribute to those things. So you want to make sure that they don't have an uncorrected eye problem.
Okay. Okay. So right now, kind of in the midst of this COVID-19 pandemic, a lot of parents are kind of worried to bring their children into any kind of medical facility, just risking spreading germs, getting sick from others that may be around. Just what are some safety precautions that you've noticed, or even that your practice is taking, just to kind of help reduce any chances of spread of COVID? And what would you recommend to parents, any safety precautions that they take when taking their children into doctors' offices currently during these current times?
So in the midst of COVID-19, our practice, which I think like most practices, are following the guidelines set forth by the American Academy of Ophthalmology, as well as the governor of Kentucky. So we limit the visits to the specific patient being seen and one adult as much as possible. We do screen for COVID-19 and check temperatures at the front desk. We limit the use of the waiting room, having their car as a waiting room, more so. We deeply sanitize the exam rooms in between patients. And we actually use telemedicine when possible. So I think, and most importantly, we require everyone to wear a mask. And most of the little children are able to do this. So it's really cute. So I'd say, even the 2-year-olds, younger than that, they're not, of course, but in most cases, they're able to do so.
And then kind of on the similar topic, all related to the COVID-19 times that we're in, with a lot of schools going back to school virtually, children are in front of a screen now probably more than ever, and just want to know if the additional screen time or any screen time can have any impact on their eyes. And then if so, what do you recommend to parents to kind of limit that screen time or to help reduce any strain that the eyes might have?
So that is a very difficult topic, because you're right. The excessive screen time can cause several problems. If you think about it, there are 3 reading distances. So reading and writing is like the standard distance. Then computer, like desktop distance, is a little bit further. And then you have tablet and smartphone usage, which is significantly closer than even reading and writing. So that distance especially can cause eye strain even after 1 hour of use. So in that situation, I would try to, use desktops would probably be ideal, or laptops, and to take frequent breaks as much as possible. And the schools are probably going to be, implementing this as well. But try to follow the 20-20 rule, which is taking a 20-second break every 20 minutes. Now, most of the classes are probably not 20 minutes long, but you know, you can just keep that in mind that whenever you do have a break, to make that break looking out the window or just away from your screen. Another thing is that with the screen use, there actually has been a doubling of myopia or nearsightedness in the past 50 years in this country. So part of that, one hypothesis is that the wavelengths emitted from the screens may make our eyes longer when we're children, which induces nearsightedness. So again, taking those frequent breaks, trying to spend at least an hour outside, aerobic if possible, could help. And there have been some reports of excessive screen time causing acute strabismus or misalignment of the eyes. So just another reason to try to take these frequent breaks. And lastly, I would try to avoid using the screens, any digital devices, for children and adults 1 to 2 hours before going to bed, because that light can disrupt our circadian rhythm and therefore disrupting a good night's sleep. So that goes for everybody.
All right, so
take
no
frequent breaks and spend some time outside.
Okay. All right. That sounds good for everyone. Other than screen time, just what are some common safety precautions that parents can take within the home to maintain eye safety? I know a lot of these will be kind of common sense, you know, don't let your kids play with fireworks or, you know, shoot BB guns at each other, but, you know, other than those type of things, what are just some basic household safety things that parents may not think about?
So first of all, when a child is old enough, you know, to talk about it, I would just have a conversation about their eyes. And, you know, most of us take our eyes for granted until something happens to them. So just to let them know that, you know, you can be injured in your eye. So sharp toys are common reasons for eye injuries in children, as well as I would avoid having any wire hangers in the house. And of course, fireworks, BB guns, you know, if you have to do it, then just be really careful. Also, contact sports are very common injuries in the eye. I see many patients, basketball players, you know, tennis players who get elbowed or hit by the ball in their eye. And that can cause, that's a very high risk for glaucoma and, you know, retinal detachment. So just, even though it's uncomfortable to wear safety or sports glasses, I do recommend that. Mm-hmm. So those would be the main things. And then in certain pathologies, we might advise not using a trampoline, but that would be very patient specific.
And then if a child does receive an eye injury while at home, kind of what's the first step they should take, or what should they do immediately?
So first, they should reach out to their pediatrician, or if they already have a medical eye doctor, they should reach out to their ophthalmologist or optometrist. And otherwise, if they cannot get hold of them or they don't have one, then they should go immediately to the emergency room, a pediatric if possible. And very important is to not eat or drink anything until the child is evaluated, because sometimes those children need to go to the operating room and be under general anesthesia. And if they have anything in their tummy, then that will be delayed.
Okay. That's a good tip. So, well, that is all of the questions that we had. I think that was kind of our top questions that a lot of parents have raised or asked over the years that I've been here. You know, those are kind of the common ones that we get every year, kind of at the state fair and other screening events. So thank you for your time. Do you have any other information you'd like to share? Or
I would just add that in general, I get asked this question a lot. What is the best food for my eyes? Mm-hmm. So I would say in general, just having a healthy diet. I often recommend the Mediterranean diet, which is more plant-based, lean meats, things like that, lots of fish. That in general is very good for our eyes. Also, when you're outside, try to wear a brimmed hat or sunglasses. Those would be the main thing. And not to smoke. Very important.
Yeah, yeah. All right. Well, thank you so much. We will let you get to your day. I know that you have a busy day ahead, but just thank you again for joining us. And we hope to be able to see you soon again in person at some of these vision screenings. I know you normally help us with Churchill Downs, and we always appreciate that. So I'm not sure if that will be happening yet this year, but we will see you as soon as we can.
Yes, thank you. I look forward to it. And thank you for giving me this opportunity.
All right. Thank you, Dr. Gupta. Have a good day.
Thanks. You too. Bye.
Bye.